Welcome to SVGTV's news for Wednesday, December 1st, 2021. I'm Triska Campbell with the details. The Ministry of Health, Wellness and the Environment said it is closely monitoring the current situation of hand, foot and mouth disease as there have been increased reports of cases across the country. Hand, foot and mouth disease is a common viral illness among infants and children under the age of 5 years, but can also occur in adults. The disease is caused by a group of viruses known as enterovirus. The virus can spread from person to person through close personal contact, such as hugging an infected person, the air when an infected person coughs or sneezes, a contact with feces, such as changing diapers of an infected person, touching contaminated surfaces like doorknobs, then touching your eyes, nose, or mouth before washing your hands. According to the ministry, hand, foot, and mouth disease usually starts with fever, sore throat, reduced appetite, and a feeling of being unwell. It also noted that 1 or 2 days after the fever starts, painful sores can develop in the mouth, and they usually begin as small red spots, often in the back of the mouth, that blister and can become painful. The ministry further added that a skin rash on the palms of the hands and soles of the feet may also develop over 1 or 2 days as flat red spots, sometimes with blisters. It also appears on the knees, elbows, buttocks, or genital area. Generally, a person with hand, foot, and mouth disease is most contagious during the first week of illness. It is said people can sometimes be contagious for days or weeks after symptoms go away, and stress the importance of drinking enough liquids to prevent dehydration. The ministry is advising persons to take the following precautionary measures. Wash hands frequently with soap and water, especially after changing diapers or using toilet, before feeding children, preparing or eating food. Cover your mouth and nose when coughing and sneezing. Thoroughly clean a contaminated surface and soiled items first with soap and water, then with disinfectant. Avoid sending children to daycare and school if they are suffering from hand, foot, and mouth disease. Follow safe food hygiene and water practices. Avoid close contact, such as kissing and hugging infected people. And monitor children for early detection and symptoms, and take those who have persistent fever and blisters on hands and feet to your healthcare provider for treatment. Prime Minister Dr. Afghan Saabs continues to appeal to Vincentians to get vaccinated against COVID-19. Speaking on NBC Radio's face-to-face program this morning, the Prime Minister expressed concern with the large gatherings still taking place across the country, particularly at funerals, which he said is not carefully managed and could become super spreader events.
But I just want to urge again, and I'm asking the Christian community, I'm asking the police, I'm asking the mourners, all of us, because we are in a new and dangerous situation with COVID. And we have been in this situation since the proliferation of these more deadly variants.
Yes.
Obviously, the more we vaccinate, the less likely that you're going to have transmission as otherwise would have been, and less likely to get sick as otherwise would have been, and less likely to be hospitalized than otherwise, and unlikely to die.
Right.
Because the vaccine incidence of the 74 deaths thus far, all of them are unvaccinated. And of those persons who are hospitalized, 98% of them, approximately, are unvaccinated. These are the facts which are before us.
Speaking on the vaccination program on island, Prime Minister Gonsalves said there is a 90% vaccination rate among the frontline workers required to get vaccinated under the Statutory Rules and Order 2021. He also noted that today, Wednesday, December 1st, is the final day for members of the police service who have not secured a medical or religious exemption to get vaccinated, and reiterated his position that he does not want to see persons losing their jobs overtaking the job.
Losing their jobs, not because I am making them lose their jobs. They're making the choice to lose their jobs. Huh? Yeah. Because I don't see any rational reason, and the science has it, that why you shouldn't take the vaccine.
What happens after today, 4:30 or 4 o'clock? Cut-off point, I guess, for working.
Well, the chief personnel, I suspect by tomorrow or Friday, the police administration, chief personnel, the commissioner of police, deputy commissioner of police, whoever is assigned this task, and they will send to the chief personnel officer the names of persons who have abandoned their job.
Okay.
And the CPO's office will begin to process whatever benefits are available to them in the normal way now.
Okay.
No. But Friday is the day for the other
category of workers?
Yeah, because remember that is they're 10
calendar
working days.
Yes, right. Okay.
So it's counted in that way. No.
SVG has received 11,000 doses of AstraZeneca COVID-19 vaccines from 42,000 doses donated to the Organization of the Eastern Caribbean States by Argentina. The Argentine Ministry of Foreign Affairs Director for Caribbean Affairs and former ambassador to the OECS, Gustavo Pandini, said St. Lucia received 18,000, Dominica 2,000, and Grenada 11,000 of the allotment provided to the OECS. According to the Argentine Foreign Minister, the collaboration is just a token of the historical friendship and positive relations between the Argentine Republic and the Caribbean region. Argentina and the OECS signed a bilateral cooperation agreement in 2013, and since then, numerous technical cooperation projects in agriculture, public health, and environment have been implemented in St. Kitts and Nevis, Antigua and Barbuda, and other member countries. In COVID-19 news now, 37 new COVID-19 positive cases were reported from 261 samples collected on Monday, November 29, 2021, resulting in a positivity rate of 14.2%. 15 new rapid antigen positive results were also reported from flu clinics on Monday. There are currently 4 patients admitted for COVID-19 at the Argyle Isolation Facility. All are said to be unvaccinated. 6 patients have also been admitted to the COVID-19 ward at the Milton Cato Memorial Hospital. 5 of these patients are unvaccinated and 1 fully vaccinated. No new deaths were recorded over the reporting period. 1 new recovery was noted over the reporting period. 496 are currently active, and 74 persons with COVID-19 have died. 5,562 cases of COVID-19 and 4,992 recoveries have been recorded in SVG since March of last year. St. Vincent and the Grenadines today joined the global community in celebrating World AIDS Day under the theme End Inequalized, End Pandemic, End AIDS. The acquired immunodeficiency syndrome, or AIDS, as a life-threatening disease which a person's immune system becomes weak and redundant, thereby causing it to easily get affected by various common infections, in which most cases lead to death. AIDS coordinator for public sector entities with the National AIDS Secretariat, Winfield Tanis Albert, said World AIDS Day is a significant one as it gives persons living with HIV and AIDS the opportunity to appreciate who they are, knowing that they are still alive.
They're living healthy, and they're having things where there's a support group for them so that they can come talk about their problems, where also they are given food packages and support. And also this day is significant for those persons who do not know what their HIV status is, to come and get tested in order to know your status. So then you can have a change of lifestyle by protecting yourself, using a condom. If you cannot abstain, it's just a day to celebrate people living with HIV and to celebrate those who have died fighting for the cause to eliminate stigma, discrimination, and HIV/AIDS.
Speaking on the issue of mother-to-child transmission, Tanis Abbott said there has been a decrease in these cases over the years, which is also worth celebrating.
If there's a child, let us say, it don't normally happen in St. Vincent anymore where we have a mother-to-child transmission, but a child can be infected from a mother if the mother chooses to breastfeed that child, not remembering that once you breastfeed, the child will become HIV positive. But children now in St. Vincent being born with HIV is long gone. So the mother to transmission, we have a good record of that at this stage. Also, once you're HIV positive, we will do the test. When you come to us for the test, which is the National AIDS Secretariat, we do the test. Once the test is confirmed positive, we will then send that test and send you to the laboratory at the Milton Cater Memorial Hospital to have a confirmatory test. That test will confirm if what we did positive is also positive. Once it is a positive test, we then send you to the infectious disease clinic where you will see the doctor and the nurse, and from there on they'll put you on to medication and you become part of the system.
The HIV and AIDS coordinator for public sector entities used the opportunity to encourage persons to get tested and know their status, and those who already know their status to take their medication.
I say to those people who are HIV positive, once you know your status and you have not started medication, please go. HIV don't kill you anymore. It's more like a chronic disease now. What kills you is if you're not taking care of yourself. So we are asking that you adhere to your medication, you eat healthy, you do your normal exercise, and you live life as if you're not HIV positive, because stigma and discrimination also plays a big role. And we have been seeing there have been a lot of self-stigma and self-discrimination where you give people the opportunity to know that you're HIV positive because you're self-discriminating and stigmatizing yourself. I'm encouraging the general public, please, if you can't abstain, wear a condom.
Tanis Abbott is encouraging persons to come out on Friday, December 3rd at the Belair Health Center to get tested. He noted that this year's activities to celebrate World AIDS Day were scaled down due to the COVID-19 pandemic.
The activities we have is what is happening here right now, and also on Friday, 3rd December, we go to the Belair Health Center from 9 a.m. to 3 p.m. And the reason why we have scaled on activities is because of COVID-19. So we have to protect ourselves and protect others as well who we are going to serve.
And Director of the Caribbean Partnership Against HIV and AIDS, Vaccination, Dr. Roswin Adams, said the Caribbean is lagging behind global targets to end AIDS.
Disruptions from the ongoing COVID-19 pandemic, we expect to be off track at the end of this year. Therefore, this is the time for all of us to work together more than ever to bring us back on track and to accelerate progress towards eliminating AIDS by 2030. The Pan-Caribbean Partnership Against HIV and AIDS PANCAP will continue to work with national programs, civil society organizations, donor agencies, and other stakeholders to ensure a coordinated regional response that focuses not only on biomedical interventions, but also on other determinants such as stigma and discrimination, barriers to access, prevention and care services, and behavior change that require the participation of everyone, including women and adolescent girls and key populations. As we pause and look back on the progress that we have made so far, let us all unite together in moving forward. Let us all be agents of change. Together, each one of us can play a part in ending AIDS.
The scientists attached to the UE Seismic Research Center have ended their tour of duty here in SVG. It has been 8 months since the last explosion in the 2020-2021 eruption of La Soufrière volcano. The Soufrière Monitoring Unit at the National Emergency Management Organization, NEMO, will now assume responsibility for the operations of the Belmont Observatory. Day-to-day monitoring of the volcano will be supported by the UE Seismic Research Center, reportedly at its base in Trinidad. The on-island seismic staff rotation ends an almost year-long occupation of the Belmont Observatory after detection of a new lava dome at La Soufrière in late December 2020. UE Seismic Research Center scientists based at the observatory oversaw the upgrade of the local seismic ground deformation monitoring networks, conducted other fieldwork and ground-based measurements, and advised the government of SVG in the run-up to the onset of the explosive activity on April 9, 2021. Senior Research Fellow Geologist at the UE Seismic Research Center, Vaccination Professor Richard Robertson, believes that the volcano will now go through a period of adjustment, saying the mountain went through a traumatic experience and will take some time to reshape itself. UE Seismic Research Center Director Dr. Urusilla Joseph refrains the center's commitment to SVG in this new phase of activity and to provide to NEMO and the government. The volcano alert level of La Soufrière remains at yellow. And the World Bank Board of Executive Directors has approved US $40 million for the volcanic eruption emergency project here. The project is also financed by a US $2 million grant from the European Union's Caribbean Regional Resilience Building Facility, managed by the World Bank's Global Facility for Disaster Reduction and Recovery. In April 2021, the explosive eruptions of La Soufrière volcano damaged critical services, infrastructure, and agriculture, affecting the entire population of the island. The eruption also resulted in significant population displacement. Approximately 22,400 people were evacuated from areas close to the volcano, many remaining in shelters for months. The natural disaster compounded the effects of the COVID-19 pandemic, creating financing needs estimated at US $175 million, 23% of the country's gross domestic product in 2021. World Bank Country Director for Caribbean Countries, Lila Brucheke, said the people of St. Vincent and the Grenadines who have endured the twin shock of the volcanic eruption and COVID-19 will benefit from the volcanic eruption emergency project, which will help the country build back better while taking into account its vulnerability to natural disasters, a growing threat of the climate change. She said the project will support the government's efforts to restore infrastructure, stimulate economic activity, and assist the most vulnerable in the population, particularly women, noting that it is their hope that the project will be a catalyst for growth and strength in the community's resilience. The volcanic eruption emergency project will support the rapid restoration of critical infrastructure damaged by the volcano eruptions. It will also improve the government's capacity to respond to future emergencies, provide temporary grants to 4,000 displaced households, and be used to implement a cash for work program to support labor incentive work of cash and details cleaning. In April 2021, the World Bank provided US $20 million to SVG to address immediate needs, and the bank allocated a further US $50 million for budget support in June 2021. The Volcanic Eruption Emergency Project financing, which is from the International Development Association, ITA, is interest-free with a maturity of 40 years, including a grace period of 10 years. Several fishermen from the North Leeward constituency and Beckway in the Northern Grenadines are among the latest batch of fisherfolk to receive materials from the Fisheries Department to construct fishing pots. The government-led initiative is to assist fisherfolk who were impacted by the COVID-19 pandemic and eruptions of La Soufrière volcano. The materials received is to increase the fisherfolk landing and improve their income. The recipients in the North Leeward constituency expressed gratitude to the government for the materials.
Just want to say thanks to the government for contributing this stuff here. Yeah. So right now I will go and catch more fish now, extend my fishing days and so go deeper, you know.
And I thank I if we am here to catch some lobster and some redfish.
Well, I'm thank the government for this little donation will help you out with the fish pot and fisheries. Because me as a man, I don't do little night fishing and daytime fishing, so this is a good help out to me when me fish, because they lose a fish pot in anywhere somebody take my fish pot, so this is a good little help out again.
I'm very thankful for the support from the government and the Fisheries Department, you know, for these buoy and wire so that I could make some fish pots, you know, and get more involved in the fishing industry.
And I thank all you very much for what all you done for us as fishermen, and God bless you guys.
I'm been thankful for these materials to build fish pots, so I'm going to make great use of them and try to mind my family and all of that. I'm very thankful of the government of St. Vincent and the Grenadines.
The recipients in Beckway said with many challenges facing fisherfolk island-wide, they are thankful for the assistance provided to help improve their fish landing.
I appreciate the donation and we thank the government very much for the donation, and because in times like these, it'll be real hard, especially opening a lobster season to get fish pot wire. So we thank them very much for it because it's a great help to us.
I tend to use this fish pot wire and steel, well, we call them fish pot wire, but mostly we call them fencing wire. I tend to use them to make fish traps or lobster traps. Thank them for whatever. It's a long time now, whatever, and thank them for it.
I'm very thankful for what the government has done for us, and I appreciate it.
And I'm very thankful for the stuff that the government has given to us. I'm from Patrick Farm Beckway, and I intend to use the steel and buoys to create lobster trap to make a living.
And I'm thankful for the support that the government has given and to us. You know, this is the time in COVID and everybody needs something, you know. There's the time that thing is slow and so forth, so we're glad for the support. We're thankful for the government for that. And we'll use them widely, you know, for fishing and for lobster, so thank you.
10 fisherfolk from the Calico community were the first to receive materials from the Fisheries Division to construct fish pots. The materials provided include 20 rolls of 1.5-inch mesh and 252 lengths of steel.